A chalazion is a painless bump on your eyelid. It can affect the upper or lower eyelid. I'm Watson, and today we're taking a look at these eyelid bumps. Stick around because we'll include treatment and prevention. Chalazia, plural for chalazion, result from healed internal styes that no longer are infectious. These cyst-like eyelid bumps form around an oil gland within the lid and can cause red, swollen eyelids. The contents of a chalazion include pus and blocked fatty secretions or lipids that normally help lubricate the eye but can no longer drain out. Many chalazia drain, resolving on their own. You can help this process along by applying warm compresses to your eyelid. Gently massaging the lid can help too. But some chalazia persist for more than several weeks and grow large enough to become cosmetically unappealing. A large chalazion may press on the cornea, temporarily causing astigmatism and blurry vision. So, what causes these? Inherited tendencies are likely factors. Certain microorganisms living in or near eyelash roots also may exacerbate inflammation around the eye. Now let's talk about treatment. That's not so simple. Before I continue, please click the subscription button, then the little bell next to the button, so you can see all of our updates. Otherwise we won't appear in your recommendations, so click away. If you develop a chalazion, see an eye doctor near you to determine the best way to get rid of this annoying bump on your eyelid. In addition to providing instructions for how to apply warm compresses to your eyelid to help get rid of an eyelid bump, your doctor may prescribe a topical medication. If you're prone to blepharitis, instructions for routine cleaning of your eyelids also may be given. In some cases, even oral medications may be recommended to reduce risk factors for getting chalazia. The most commonly prescribed oral medicine for blepharitis and meibomian gland dysfunction are antibiotics such as doxycycline. Small, inconspicuous eyelid bumps may require no treatment at all. However, some blockages causing chalazia do not clear up on their own. These may cause the eyelid bumps to be persistent or even grow larger. In the case of a bothersome and persistent chalazion, your eye doctor may recommend a simple in-office surgery to excise it. An eye surgeon will use local anesthesia to numb the area before making a small incision, typically from underneath the eyelid, to clear the contents of the eyelid bump without visible scarring. An alternate procedure involves injecting the chalazion with a corticosteroid to get rid of the bump on your eyelid. So, there you go. I hope you learned a little about this topic. Have you ever had a chalazion? Tell us about it in the comments below.
Ever since I can remember, I've suffered with insomnia. I've tried everything. Nothing seemed to work. But then I found Rest More, and let me tell you, like seriously, it's the greatest. I slept for a full 8 hours. I woke up not feeling groggy. I woke up feeling refreshed. I actually had a great day, a great morning. It was amazing. So I stuck with it. It's an awesome product. It's not a habit for me. It's just great. I don't even know, like words can't even like describe how happy I am that I found this product. So Rest More is the way to go, guys. There's nothing out there before that would work for me, but Rest More.